Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh and very good day to everyone. My name is Mohd Rafee Baharudin. I'm from Universiti Putra, Malaysia, and today I would like to present my study on the implementations of PUTRAeRISK in assessing the risk level of COVID-19 amongst campus residents. As part of my introductions, I would like to highlight some of the important facts that we have. The WHO declared COVID-19 as pandemic, since 11 March 2020, and since that, in our country, we are also actually having the same problem. We have 2,031 cases in March up to 26th of March, and if you look at these slides, the red zone is actually located in Klang Valley, and Universiti Putra Malaysia are also affected, during the lockdown. Why PUTRAeRISK? Why PUTRAeRISK? The idea is actually highlighted when we are experiencing the first lockdown. Okay, what we need to do during that time is to think about how we are going to assess our campus residents. Are they safe to be inside? Are they safe, from being infected by others? And due to that reason, we came out with a plan to develop an artificial intelligence device so that we can assess everyone who are actually entering the campus. So we actually name the artificial intelligence as PUTRAeRISK, and currently we have almost 21,000 users. And the purpose of this PUTRAeRISK to ensure that everyone before entering the campus site or campus location must do a self-assessment for COVID-19. As I mentioned earlier, that the reason why we are taking very seriously about the risk of every individual in the campus is because we want to help the government to prevent the disease become worse and infect others in the community, in the nearby community. Now, this is the methodology part, right? And before I go further to the explanation on the methodology, so this is a kind of infographic information telling about the stages of movement control order. Now, if you look at the first notes, that is on 18 March to 31st of March. So this is the first phase of MCO or movement control order, and then followed by the 1st April until the 14th of April. That one we have second phase of MCO, and then followed by the from 15th of April up to 28th April, and then we have the third phase of MCO. Now, the students cannot go back to their hometown. They need to be in the campus, and we are actually looking into them in terms of the safety, health, and welfare. We are still having chances of getting infected. I mean, talking about the risk, because there are also visitors coming in the campus. There are also, the Grab foods, the food pandas, things like that are also coming, every day to deliver things. So that is one way how the infections can occur. So, and then not to forget about our staff, all right? So they are actually the frontliners. The essential industries need to be open and need to be operationalized as usual. So what we did was to ensure that everyone are in a safe zone. Uh, so we developed a website applications, so-called artificial intelligence, to help our campus residents in a very easy way. Okay, in a very easy way. We engage with the IDEC, the the one that is actually expert in doing the mobile applications or web applications using the HTML, the hypertext markup language, the cascading style scripts, and not to forget the Win SSP, the high charts, and also the JavaScript and nodes, okay, to build up our PUTRAeRISK. And we have altogether 800 respondents to be tested on the effectiveness of these PUTRAeRISK uh, apps, you see. And it took us about almost 2 weeks to completely finish the development. And what we put in the application is some of the important questions with regards to the COVID-19 signs and symptoms. And of course, when we look at the signs and symptoms, we are actually referring to the World Health Organization, the CDC, the Center of Disease Control, US, and of course, not to forget our Ministry of Health as well. So we designed most common symptoms of COVID-19, and we have for example, difficulty in breathing, coughing, sore throat, fever, and then chronic diseases, traveling histories, within the infected countries. Are you actually a close contact, with a confirmed cases, and attending events that related to the um, patients of COVID-19. And of course, we have run through the phase validity, criterion validity, and altogether we have 800 respondents. Now we move on to how we actually stratify the risk, the level of risk. We have three different level of risk, okay, known as high risk, medium risk, and low risk category. Why this is very important? Because the level of risk will determine whether they can enter the the university site or otherwise. Now, some of the examples here is on the high risk descriptions. Okay, if the person um, uh, key in or input some of the information related to, let's say they have fever, or they have acute respiratory infection symptoms, or perhaps might have difficulty in breathing, or visited countries with COVID-19 outbreak in the past 14 days, definitely they will give a results of high risk category. And not only that, we have other options. We have other options that stated on the staff who have fever or having respiratory infections such as difficulty breathing or cough or sore throat, and have travel history with COVID-19 sharing the same transport. So now we are talking about transport. And then the third one talking about the working environment, and the last one is actually living with the COVID patients. So this is the yellow zone or medium risk category. A little bit, it's still stringent it's still stringent, but not as stringent as the high risk. Okay, that is labeled as red. So in medium risk, we have staff who do not have symptoms but has visited countries with COVID-19 outbreak in the 14 days. So these are the descriptors that we use to identify the medium risk. and this is the low risk. Okay, so low risk, basically they do not shown any symptoms and have visited countries with COVID-19 outbreak in the past. Okay, so this is the result and discussion. So this is the interface of the PUTRAeRISK. So this is numbers of self-assessment that has been made, and then we can produce reports from these web-based applications, and we can produce charts. So this is the results. We have 78 person or individual that showing high risk, 189 indicating as medium risk, and the majority is in the low risk. And if you look at another graph, so this graph is actually showing the age group, and we can see here numbers of respondents who are actually in the red, medium, or green zone. So our study are actually similar to other study as well. Example is Gavin and Rochelle 2020, that this is very important things that we need to do in the campus, because we have a lot of many students inside, many staff, contractors, the e-hailing, the p-hailing drivers inside the campus. So identifying their risk is very, very important. As a conclusion, this study concluded that early assessment of COVID-19 risk using PUTRAeRISK is very essential in breaking the chain of infections. So this is an example of low risk indicators. Thank you very much and have a good day.